Good day everyone, my name is Gidget Shayne Soliman, a first-year nursing college student that will perform a return demo about proper positioning and draping. The purpose of these methods is to facilitate the examination by permitting a better access to the part being examined or treated. Before starting any procedure, always remember to introduce yourself and to verify your client's identity. This establishes rapport. Second is to explain to the client what are you going to do, why is it necessary, and how can she cooperate. This promotes cooperation. And always remember that before doing any procedure is to wash your hands and observe other appropriate infection control procedure. This helps to prevent transmission of microorganism. And the last one is to provide your client's privacy. This keeps the client safe, comfortable, and to prevent undue exposure of any body parts. The first position is the erect, the standing or upright. This position allows the examiner to assess posture, balance, and gait. This position is also used for examining the genitalia.
Assist the patient to stand with their slippers on or with bare feet on piece of paper. Place the chair one side where hand of patient can rest for support. For vaginal examination, elevate one foot on a low stool as far as it is comfortable for the patient.
The next is the sitting position. This position is good for evaluating the head, neck, chest, lungs, back, breast, heart, vital signs, and upper extremities. This position is also useful because it permits full expansion of the lungs and it allows the examiner to assess symmetry of upper body parts. Now, some clients may be unable to sit up for the entire examination. They may need to lie down, face up, or we called it a supine position, and rest throughout the examination. Now, other client may be unable to tolerate this position for any length of time. An alternative for this position is to lie down with the head elevated.
The buttocks are firmly at the edge of the bed or at the foot of examination table. The thighs are well supported. The knees should be bent and the feet should be positioned flat against the floor or a footrest. A gown may be used to cover the upper body. A drape or draw sheet covers the waist and legs.
The third one is the horizontal recumbent position, supine position. Before doing this procedure, make sure to assemble two supplies, a clean gown or disposable gown and a draping sheet. This position allows the abdominal muscles to relax and to provide easy access to peripheral all sides. Areas assessed with the client in this position may include the head, neck, heart, lungs, breast, axillae, abdomen, and all extremities.
Assist the patient to lie on his back with legs extended or slightly flexed to relax the abdominal muscle. Place pillow under the head and smaller one may be placed under the knees for support. Arms will be crossed on the chest and comfortably flexed on the side above the head or lie loosely at the sides of the body. Put the sheet over the patient, covering completely from the neck to the shoulders downward with the tucking it under the mattress.
The fourth one is the dorsal recumbent position. This position may be more comfortable than the supine position For the patient, the client with pain in the back or abdomen, areas that may be assessed with a client in this position includes head, neck, heart, lungs, breast, extremities, and peripheral pulses. The abdomen should not be assessed because the abdominal muscles are contracted in this position.
Assist the client to lie on his back, separate the legs, flex the knees so that the soles of the feet are flat on bed. Place arms either above head or flex the hands on the chest. Place one pillow under the head. Bring the buttocks of the patient to the edge of the bed. Place the draping sheet diagonally on the patient so that the opposite corners covers the legs. Wrap corner on the right side around the right foot. Do the same with the left side. Fold the lower corner of the sheet back on the abdomen to expose the part to be examined when the doctor is all ready to do so.
The fifth one is the dorsal lithotomy position. The lithotomy position is used to examine the female genitalia, reproductive tract, and the rectum. The client may require assistance to get into this position. It is an exposed position, so the client may feel embarrassed. In addition, elderly client may not be able to assume it for very long or at all. Therefore, it is best to keep the client well draped during the examination and to perform the examination as quickly as possible.
Assist the patient to lie on her back, separate the legs and flex the thighs deeply toward the abdomen. Draw down the buttocks to the following edge of the table. Raise the arms above the head or flex them with the hands on the chest. Drapes as in horizontal recumbent. Preferably use the lithotomy drape.
The next one is the Sims position or Sims lateral position. This position is useful for assessing rectal and vaginal areas. The client with joint problems or elderly clients may have some difficulties in assuming and maintaining this position.
Assist the patient to lie on the left side with the body inclined forward. Extend the left arm behind the back and flex the elbow of the right arm forward. Flex the thigh forward the abdomen with the knee drawn up higher than the left knee, which is long slightly flexed. Lay out the draping sheet as in horizontal recumbent position. Fold back and or gather side of the sheet and expose the area to be examined.
The next is the prone position. The prone position is primarily used to assess the hip joint. The back can also be assessed with the client in this position. The client with cardiac and respiratory problems cannot tolerate this kind of position.
Help the patient to assume the horizontal recumbent position. Assist her to turn over onto the abdomen. Turn the head to one side. Place arms at sides or flex right extend upward. Allow the feet to hang over the edge of the mattress or support on a pillow high enough to keep the toes from touching the bed. Drape as in horizontal recumbent position.
The next is the Fowler's position. It is an intervention used to promote oxygenation via maximum expansion, chest expansion, and is implemented during events of respiratory distress. Fowler's position, it facilitates the relaxing of tension of the abdominal muscles, allowing improved breathing.
Place the patient in a horizontal recumbent position. Elevate the head of the bed to approximately 45-degree angle. Flex the knees slightly and support them with knee rolls. Drape as in horizontal recumbent position.
The next is the Tredelenburg's position. In the Tredelenburg's position, the body is laid supine or flat on the back on a 15 to 30 degree incline with the feet elevated above the head. Now, the reverse Tredelenburg's position similarly places the body supine but the head is now being elevated. The Tredelenburg's position is used for surgery, especially for abdominal and genitourinary system. It allows better access to pelvic organs as gravity pulls intra-abdominal organs away from the pelvis.
Assist the patient to horizontal recumbent position. Elevate the foot of the bed so that the lower trunk is higher than the head and the shoulder. Support the shoulders and knees. Drape as in horizontal recumbent position.
The last one is the knee chest position. The client kneels on the examination table with the weight being supported by the chest and the knees. A 90-degree angle should exist between the body and the hips. A small pillow can be provided and used to provide comfort for the client. The knee chest position is useful for examining the rectum. This may be embarrassing and uncomfortable for the client, so therefore the client should be kept in this position for as limited as time as possible. Elderly client or client with respiratory or cardiac problems may be unable to tolerate this kind of position.
Place the patient on prone position. Assist her to kneel with knees slightly separated. Bend forward so that the chest is resting on the bed and the thighs are perpendicular to the legs. Turn the head to one side and place the arms either above the head or flex at the elbow and rest along the side of the head. Drape as in horizontal recumbent position.